What if I told you that up to 70% of prostate surgeries performed today are unnecessary? What if thousands of men are undergoing life-altering procedures that destroy their sexual function and quality of life when safer, equally effective alternatives exist? I'm Dr. James Whittaker, and today I'm exposing the uncomfortable truth about the prostate surgery industry and revealing the evidence-based alternatives that most urologists won't discuss with their patients. Every year, hundreds of thousands of men undergo prostate surgery, believing it's their only option for dealing with an enlarged prostate or prostate cancer concerns. But the statistics are alarming. Up to 60% of men experience permanent erectile dysfunction after radical prostatectomy, 40% develop urinary incontinence, and many suffer from depression and relationship problems. What's even more shocking is that many of these surgeries are performed on men who could have achieved excellent results with non-surgical approaches. The medical literature is clear. Watchful waiting, lifestyle interventions, and targeted therapies often produce outcomes equal to or better than surgery without the devastating side effects. Today, I'll explain why most prostate surgeries are rushed, unnecessary procedures that prioritize profit over patient outcomes. And I'll give you a comprehensive action plan that addresses prostate problems naturally and effectively. Understanding the two main prostate problems. Before we discuss alternatives, you need to understand the two primary prostate conditions that drive most surgical recommendations: benign prostatic hyperplasia, or BPH, which is non-cancerous enlargement, and prostate cancer. For BPH, surgery is almost never urgent. This condition develops slowly over years, and symptoms can often be managed or reversed through natural approaches. Yet many men are rushed into surgery after a few months of symptoms before trying proven alternatives. For prostate cancer, the situation is more complex, but studies consistently show that many prostate cancers are slow-growing and would never become life-threatening. The concept of overtreatment in prostate cancer is well established in medical literature, yet aggressive treatment remains the default recommendation. The BPH surgery trap. Let's start with BPH surgery, which includes procedures like TURP, transurethral resection of the prostate, laser surgeries, and various newer techniques. These surgeries are marketed as minimally invasive and highly effective, but the reality is quite different. The success rates for BPH surgery are often overstated. While these procedures can improve urinary flow initially, many men experience complications and symptom recurrence within a few years. More importantly, the side effects can be permanent and devastating. Retrograde ejaculation occurs in up to 90% of men after TURP, meaning semen flows backward into the bladder instead of out through the penis. This effectively ends normal sexual function for most men. Erectile dysfunction rates range from 15 to 30%, and urinary incontinence affects 10 to 15% of patients. What's particularly troubling is that many men undergoing these surgeries have only moderate symptoms that could be significantly improved through lifestyle changes, natural supplements, and dietary modifications. The prostate cancer surgery deception. Prostate cancer surgery, particularly radical prostatectomy, is even more problematic. The medical establishment has created a culture of fear around prostate cancer that drives men toward aggressive treatment, even when their cancer is low risk and unlikely to cause harm. Here's what most urologists won't tell you. Many prostate cancers grow so slowly that they would never become life-threatening. Studies following men with low-grade prostate cancer for 20 years show that the vast majority die of other causes, not prostate cancer. The Prostate Cancer Intervention versus Observation trial, published in the New England Journal of Medicine, compared surgery to watchful waiting in men with localized prostate cancer. The results were shocking. There was no significant difference in overall survival between the two groups, but the surgery group had dramatically higher rates of sexual dysfunction and urinary problems. Yet despite this evidence, most men diagnosed with prostate cancer are immediately counseled towards surgery, often being told they need to act quickly or the cancer will spread. This creates unnecessary panic and leads to hasty decisions with lifelong consequences. You might wonder why doctors continue to recommend surgery when the evidence shows it's often unnecessary. The answer involves several troubling factors within our medical system. First is financial incentive. Prostate surgery is extremely profitable for hospitals and surgeons. A single robotic prostatectomy can generate $50,000 or more in revenue, while counseling a patient through lifestyle changes and monitoring generates very little income. Second is medical training bias. Most urologists are trained as surgeons, and their expertise lies in surgical procedures. They're much more comfortable recommending surgery than spending time on lifestyle counseling or nutritional approaches. Third is liability concerns. Doctors worry more about being sued for missing cancer than for performing unnecessary surgery. Recommending surgery is seen as defensive medicine, even when it's not in the patient's best interest. Fourth is time constraints. It takes much more time to educate a patient about alternatives than to schedule surgery. In our rushed medical system, surgery often becomes the default recommendation. Must please take a moment to hit that subscribe button and ring the notification bell. The prostate health information I'm sharing today could save you from unnecessary surgery and permanent complications. But YouTube doesn't always show my videos to everyone who needs them. Subscribing ensures you never miss these critical health insights. Now let's discuss what you should do instead of rushing into BPH surgery. The natural approach to enlarged prostate has been extensively studied and shown to be highly effective for most men. The foundation of natural BPH treatment is dietary change. Certain foods directly affect prostate size and inflammation, and modifying your diet can produce dramatic improvements in symptoms. Reduce inflammatory foods. Processed meats, excess dairy, refined sugars, and trans fats all promote prostate inflammation and enlargement. Studies show that men who eliminate these foods often see significant symptom improvement within weeks. Increase anti-inflammatory foods. Tomatoes, especially cooked tomatoes with olive oil, provide lycopene, which has been shown to reduce prostate size. Cruciferous vegetables like broccoli and cauliflower contain compounds that help metabolize hormones that contribute to prostate growth. Green tea consumption has been linked to reduce prostate cancer risk and improve BPH symptoms. The polyphenols in green tea have anti-inflammatory and hormone balancing effects. Pumpkin seeds are rich in zinc, which is essential for prostate health. Men with BPH often have zinc deficiencies, and supplementing with pumpkin seeds or zinc can improve symptoms significantly. Several natural supplements have been extensively studied for BPH and shown to be as effective as prescription medications, without the side effects. Saw palmetto is the most well-studied supplement for BPH. Multiple clinical trials show it can reduce prostate size, improve urinary flow, and decrease nighttime urination. The key is using a standardized extract with the proper concentration of active compounds. Beta-sitosterol, a plant compound found in various foods, has been shown to improve urinary symptoms and flow rates in men with BPH. It works by reducing inflammation and supporting healthy hormone metabolism. Pygeum africanum extract has been used for centuries for prostate health and has modern research supporting its effectiveness for BPH symptoms. Stinging nettle root extract can help reduce prostate size and improve urinary symptoms. It works synergistically with saw palmetto for enhanced effects. Physical activity plays a crucial role in prostate health. Regular exercise improves circulation, reduces inflammation, and helps maintain healthy hormone levels. Even moderate activity like daily walking can improve BPH symptoms. Stress management is equally important because chronic stress elevates cortisol, which can worsen prostate inflammation and enlargement. Techniques like meditation, deep breathing, and regular relaxation can significantly improve symptoms. Sleep quality affects hormone production and inflammatory processes. Men with poor sleep often have worse prostate symptoms, while improving sleep quality can lead to dramatic symptom improvement. For prostate cancer, the alternative to rushing into surgery is active surveillance combined with aggressive lifestyle intervention. This approach is now recommended by major medical organizations for low-risk prostate cancer, yet many men are still pushed toward immediate treatment. Active surveillance involves regular monitoring with PSA tests, digital rectal exams, and periodic biopsies to ensure the cancer isn't progressing. Studies show this approach is safe for most men with low-grade prostate cancer. During active surveillance, aggressive lifestyle intervention can actually slow or stop cancer progression. This includes dietary changes, targeted supplementation, exercise programs, and stress management techniques. The research on diet and prostate cancer is extensive and compelling. Certain dietary patterns can dramatically reduce the risk of cancer progression and may even cause regression of existing cancer. The Mediterranean diet, rich in olive oil, fish, vegetables, and whole grains, has been shown to reduce prostate cancer mortality by up to 40%. The anti-inflammatory compounds in this diet help control cancer growth. Cruciferous vegetables contain sulforaphane and other compounds that have been shown to kill prostate cancer cells in laboratory studies and reduce cancer progression in human trials. Green tea polyphenols have been shown to slow prostate cancer growth and may cause cancer cell death. Multiple studies show reduced cancer progression in men who consume green tea regularly. Pomegranate juice has been extensively studied for prostate cancer and shown to slow PSA progression and potentially reduce cancer growth. The polyphenols in pomegranate have powerful anti-cancer effects. Several natural compounds have shown promise in controlling prostate cancer progression without the side effects of conventional treatment. Curcumin, the active compound in turmeric, has been shown to inhibit prostate cancer cell growth and may enhance the effectiveness of other treatments. It has powerful anti-inflammatory and anti-cancer properties. Modified citrus pectin has been shown to slow PSA progression and may prevent cancer metastasis. It works by blocking galectin-3, a protein involved in cancer spread. Vitamin D optimization is crucial because deficiency is associated with more aggressive prostate cancer. Maintaining optimal vitamin D levels may slow cancer progression. I'd love to hear from you in the comments below. Have you been told you need prostate surgery? And what questions do you have about natural alternatives? Your experience could help other men in our community make informed decisions. Many men have successfully avoided unnecessary prostate surgery through natural approaches. I've worked with patients who reduced their prostate size by 30 to 50% through dietary changes and targeted supplementation. One 68-year-old patient came to me scheduled for TURP surgery due to severe BPH symptoms. After implementing the natural protocol I've described, his symptoms improved by 80% within 3 months, and he canceled his surgery. Another patient had low-grade prostate cancer and was being pressured into immediate surgery. He chose active surveillance with aggressive lifestyle intervention. After 2 years, his PSA stabilized, his follow-up biopsies showed no progression, and he maintained excellent quality of life. I want to be clear that surgery isn't always wrong. There are situations where surgical intervention may be appropriate, but these represent a small percentage of cases. For BPH, surgery might be necessary if you have complete urinary retention, recurrent urinary tract infections that don't respond to other treatments, bladder stones, or kidney damage from blocked urine flow. Even in these cases, less invasive procedures should be considered first. For prostate cancer, surgery might be appropriate for high-grade cancers, rapidly rising PSA levels, or cancers that show aggressive features on imaging. However, even in these cases, all options should be carefully discussed, including radiation therapy and newer targeted treatments. When facing prostate surgery recommendations, use this framework to make an informed decision. First, get a second opinion from a doctor who isn't financially incentivized to perform surgery. This might be a primary care physician, an integrative medicine doctor, or a urologist known for conservative approaches. Second, understand the urgency. True emergencies requiring immediate surgery are rare. Most prostate conditions allow time for trying natural approaches first. Third, understand the success rates and complication rates for your specific situation. Ask for actual numbers, not generalizations, and make sure you understand both short-term and long-term outcomes. Fourth, understand the alternatives. Make sure you've been fully informed about non-surgical options, including their success rates and timelines for effectiveness. Natural approaches to prostate problems require time and consistency, but the results are often superior to surgery without the complications. For BPH, most men notice improvement in symptoms within 4 to 8 weeks of implementing dietary changes and targeted supplementation. Maximum benefits typically occur within 3 to 6 months. For prostate cancer, lifestyle interventions may take longer to show measurable effects, but studies show that PSA progression can be slowed or stopped within 6 to 12 months of aggressive intervention. The key is consistency and patience. Unlike surgery, which provides immediate but often temporary relief, natural approaches build long-term health and often provide benefits that extend far beyond prostate health. If you're facing prostate surgery recommendations, don't panic. Take time to implement this comprehensive approach. Start immediately with dietary changes, eliminating inflammatory foods and increasing anti-inflammatory options. Begin targeted supplementation with saw palmetto, beta-sitosterol, and other proven compounds. Implement lifestyle changes including regular exercise, stress management, and sleep optimization. These changes benefit your entire health, not just your prostate. Work with a healthcare provider who understands and supports natural approaches to prostate health. This might require finding an integrative medicine physician or a urologist who embraces conservative management. Monitor your progress objectively through symptoms tracking, periodic PSA testing, and follow-up evaluations. This allows you to make informed decisions about whether your approach is working. Most importantly, don't let anyone pressure you into immediate surgery unless you have a true emergency. Prostate conditions usually develop over years, and taking a few months to try natural approaches won't significantly change your outcome if surgery ultimately becomes necessary. The choice between surgery and natural approaches is one of the most important health decisions you'll ever make. Choose wisely based on evidence and your own values, not on fear or financial pressure from the medical system. Your prostate health is in your hands, and the natural approaches I've outlined today can help you maintain both your health and your quality of life without unnecessary surgical risks.